very important moment now. That the milestone is starting now, and you have the civil society hearings tomorrow, which will be very important for the preparation for the high-level meeting soon in June. That probably will be the last UN review on HIV and AIDS until 2050, when governments will come together to review as a whole the Millennium Development Goals. There is a lot of criticism now in relation to this strategy. We really need to be aware to not go into shopping lists, and making sure that tomorrow our speech will be really based on having a political perspective, and in our case, how to keep women in this agenda, but at the same time, how to make sure that political commitment will increase and not decrease, as we are seeing now in many countries. Funds will be available in the way we need them, and what we see is that the funds available for prevention, and this is a very important point to all of us, is not reaching women as it should be reaching women. I think we need to strengthen our voice for tomorrow, and I think that women really need to push for a strong dialogue with civil society. So I will stop here, and then I will give the floor to Tyler.
The Global Coalition leadership had identified that there was a missed opportunity to have women really participating and have women have a clear voice and sharing what their visions and priorities are for the high-level meeting process, and mechanisms to strengthen the engagement of women and girls wherever possible in these processes. And so what's been fantastic is we were able, in the span of 5 weeks, to pull off a global consultation with regional focal points and leadership, with over 700 women and girls participating from over 95 countries. And we had our survey tool go out in 9 different languages. So it's been a really rich and collaborative endeavor, and I thank deeply all of you who've been a part of this.
The sexual and reproductive rights of women who were HIV positive was not a focal issue. It was addressed if you were there, but there was no specific program outside of the prevention of mother-to-child transmission, which again you were the mother. Because we make up the large majority, we are the workers, we do a lot of it, and the men need to hear our voice.
In the U.S., biased and limited sexual education in schools is the norm, particularly in the South. So oftentimes we're coming from a Republican-based education system around sexual and reproductive health that solely promoted abstinence. There are so many gaps, and so we're seeing from young women, as well as older women, as well as school-age girls, the survey really highlighted the need for stronger sexual and reproductive health education and services, and also an enabling policy environment, but also an enabling environment at the clinic level, at the provider level, to make the service actually accessible. Beyond transportation, but actually having providers who are willing to render those services in an inclusive way. Another thing that was really highlighted was that women living with HIV have a heightened challenge with accessing reproductive and sexual health services. Most of the services are focused on prevention and vertical transmission, and there's a real need for women living with HIV to prevent other comorbidities and other STIs. Of course, gender-based violence was addressed, and a lack of programming and a lack of inclusion for women, and also the heightened risk for women living with HIV.
In terms of gender equality, we are also seeing HIV and AIDS as an opportunity as opposed to a problem. Well, this is because gender inequality has existed in big ways in Africa, and we are wondering how can we use HIV and AIDS to address these gender inequalities that have affected women in Africa for centuries and centuries. We all acknowledge that many of our countries have set legislation, but then, as the document said, legislation around domestic violence, sexual violence, and other laws that protect women's rights exist on paper, but are not frequently not translated or comprehensively implemented. So we also think this legislation is not implemented because people are not aware, and the demand for the implementation is actually very low. And so there is need for communities to be empowered to start asking and demanding for these services. Finally, we also acknowledge women living with HIV and AIDS have been working in isolation, and we are trying to see how can we move all women movements to support women living with HIV and AIDS, and at the end of the day, it will be in the best interest of all women. I think there's a lot that we need to do, particularly in terms of putting other women's movements together with women living with HIV and AIDS movements together. Thank you.
There was a very interesting demographic of women and girls that participated in the survey, and this was largely because there was a lot of further on-ground translation that happened across the board in the region as well. 4 specific asks sort of in that shopping list. One was around ensuring a cross-cutting approach to comprehensive sexuality education as something that would be a strong preventative strategy. The second was around a lot of women challenging the whole idea of increasing stigma and discrimination by isolating women into at-risk groups, and the need to be able to provide comprehensive support, care and services, but to go beyond that. And in line with that, the third was to particularly look at the legal environment, how that could be more enabling, both in terms of decriminalization, as well as looking at issues of employment, income and property rights specifically. The last that was particularly important was a scale up with requests to safe abortion services, with looking at not just having antenatal care services, but also an increase specifically with voluntary testing. I think something that definitely came across was the whole need to say that if we're talking about women and all of their solidarity, that the multiple and overlapping needs of services need to be looked at for women, and the fact that these need to be both comprehensive and youth-friendly. So focusing beyond the specific service and looking at the enabling environment and how that could actually make it easier for women to be able to address and access rights.
From the priorities we find out from the region is treatment, care and support for women living with HIV in all their diversity is one of the issues we find out. And we notice that women living with HIV doesn't have access to care and support in the region. And we also, solidarity also is another issue, trying to eliminate stigma and discrimination, most especially in the healthcare facility, because women living with HIV are always often discriminated and stigmatized against in the healthcare settings. Another thing again is safety. A woman raped by her husband cannot access to healthcare services. It looks strange to women living with HIV in the region because a woman should not be raped by her husband. A woman should be a property. So anytime the husband wants it, from morning till night, she should be available to give it to him. So there's nothing like rape. And even the issue of safe abortion. We know that if abortion is safe, it will help women to live long. It will help women to go out there to the hospital and say, I want to have an abortion. But even when abortion is not legalized in our own region, women still carry out abortion, and they die in the process. So it is an issue. And I believe that in this meeting we will continue to push and we'll get there. Thank you very much.
Since the Latin American services are focused to men, there's a lack of linkage between HIV services and sexual and reproductive health. And there's a lack of integration of addressing violence, sexual violence, psychological violence, and emotional violence for women. And the second thing is that for the region it's very important to have education, including sexual education. As we know, this is the only region that has a ministerial declaration that is ensuring, supposedly, that we have sexual education, not just inside of the school, but also outside of the school.
Thank you.